Well, for the month of October, WMAR is partnering with GBMC to bring you a day-long breast cancer house calls event. As part of this, we'd like to welcome Dr. Sara Fogarty. She is the director of the Sandra and Malcolm Berman Comprehensive Breast Care Center at GBMC. Thank you so much for being with us.
Thank you so much for having me.
So I just want to start out with the basics. When it comes to breast cancer, describe what it is exactly, because I know that there are different types and it shows different symptoms.
Sure. Breast cancer is the abnormal growth of your normal breast cells, like what all cancers are. And there are many different types, and the different types really dictate what treatment recommendations there are. And this is part of what we do every day in taking care of women with a new diagnosis of breast cancer. We go through the different types, what that patient's type is, and how we need to manage it. And so everybody's care here is very, specific and tailored to them. A lot of women don't realize that there's different types and come in with the idea that, well, my aunt had bilateral mastectomies and chemo and radiation. How are you telling me I don't need any of that? And so, it really makes a difference depending on what their biopsy shows. So that's part of what we spend a lot of time discussing with them here.
And that all starts out with screenings to begin with, correct? What are the screening recommendations? And I know that they change from time to time. So what are they currently?
Correct. That's a very complicated issue, honestly. There's a lot of different recommendations from a lot of different bodies in medicine. The American Society of Breast Surgeons recommends annual screening mammogram yearly starting at the age of 40. But with the caveat that women that are higher risk may need to start screening earlier. And this is something that women's primary care doctors and gynecologists should be discussing with them as they get towards that 35-year, 40-year mark. Screening mammograms, especially with 3D tomosynthesis, are really the standard for screening annually. We also use ultrasound and MRI to help with screening depending on a lot of different factors, and that's something that we tailor also to individual patients.
Now, this is a very interesting time. We've all been stuck at home with COVID and social distancing. If someone has missed their mammogram because of this pandemic, is it safe to come back to the hospital for that mammogram, or should they wait or try and go to the office? What do they do?
Yes, it's absolutely safe to come back to the hospital now. Mammograms were screening, imaging was shut down during the height of the pandemic here in Maryland, and we weren't doing mammograms for a few months, and that's opened since May. We are doing a lot to keep people safe. Our imaging center on GBMC's campus is in the hospital, but in a very kind of isolated corner. We're not near the floors where patients are admitted. We have a very clear way of having patients wait in their cars for their imaging so that they get text messages. And when the imaging is ready, they're not waiting in a waiting room. So we're really trying to keep our waiting rooms empty. We are working very hard to clean constantly. My staff in my office and the radiology staff is cleaning all the time. I feel safer there than I feel at any grocery store, honestly. And women have been coming back, and we're trying to fit everybody back in as soon as we possibly can. And I absolutely would recommend people coming back and getting back on their screening schedule because it is really important. And, it was delayed for some women 6 months or more, really. And so we're really trying to get people back on track.
That makes a lot of sense. Dr. Fogarty, thank you so much for being with us. And we want to remind everyone to tune into WMAR2 News tonight at 5 p.m. for more breast cancer house calls with GBMC. We'll be right back with more Midday Maryland right after this. Stay tuned.